How to draw a heart.
No, that's not right.
How to draw a heart.
That's closer.
How to draw congenital heart.
Congenital!
Heart disease.
In my cardiac ICU, we have kids with some wild cardiac anatomy, so in every room is a drawing of that patient's heart. Now we've got a file with dozens of hearts I can print off. Even with that, most of these require whiteout and a black marker to get close, and sometimes no pre-made diagram is going to be right. Part 1 of this video series will teach the steps to drawing a normal heart. Part 2 will use those same steps, but apply it to complex congenital heart disease. One disclosure. These drawings are a way to diagram the relationship between structures in the heart and to help us visualize where the blood flows. They do not represent how the heart is situated in the chest. For that, you'll need to learn the cardiac gang sign, and that's for another time. Also, this is how another person's heart looks if you are looking at them from the front. So the person's left is on our right, and the person's right is on our left. So get a piece of paper or a whiteboard, and let's get started. There are 5 steps to drawing a heart. You can follow these no matter what type of heart you are drawing. Number 1, ventricles. Which direction are they pointed, and how many are there? Most hearts are levocardic, meaning the apex of the heart is pointed to the person's left. For a normal heart, 2 ventricles and a muscular septum in between. This heart does not have a VSD, so we'll draw the perimembranous septum. Left ventricle and right ventricle, because in congenital heart disease that's not always obvious. Number 2, semilunar valves and arteries. How many and which ventricle are they attached to? In this case, we have an aortic valve on the left and a pulmonary valve on the right. The pulmonary valve is slightly higher. The main pulmonary artery is in front of the ascending aorta, so draw that first, jutting to your right. This is a left aortic arch with 3 branches heading to the upper body. The right branch pulmonary artery is behind the ascending aorta. Number 3, the atria and venous return to the heart. 4 pulmonary veins return to the left atrium. The right atrium gets the superior vena cava and the inferior vena cava. An intact atrial septum is between. Number 4, finishing touches. Draw in the AV valves. Circles at the end of vessels look good but aren't necessary. Color in the myocardium. And number 5, show where the blood goes. This isn't as important for a normal heart, but becomes a big deal when drawing congenital heart disease. And there you go, you drew a normal heart.